In the early months of the COVID-19 pandemic, the world watched healthcare workers routinely surge into infected wards without adequate protection, risking their own lives for complete strangers. But behavioral psychologists like B.F. Skinner viewed these acts with deep skepticism. He argued that we only credit people for good deeds when we lack an external explanation. To strict behaviorists, true selflessness is a myth. This is the core debate between egoism and altruism. Egoism proposes that every heroic rescue or donated kidney is actually a disguised selfish transaction. To understand why we risk our lives for others, or why we chillingly ignore them, we must expose the hidden psychological ledgers governing our brains. This animated scale shows what psychologists call social exchange theory. Before you help someone, your brain instantly calculates the costs, like physical danger or lost time, against the rewards, like social status or praise. It's a rapid-fire mini-max strategy. Minimize the cost, maximize the reward. Data shows that observing a person in pain triggers our own physiological distress. This feel-bad, do-good mechanism suggests we often help others specifically to lower that internal arousal and expunge our personal guilt. Biologists take this transactional behavior down to the cellular level with kin selection. Our genes program us to protect our immediate relatives and in-groups simply to ensure our own DNA survives the evolutionary filter. Even when we help complete strangers outside our gene pool, we are operating on the reciprocity norm. We do favors with the hardwired biological expectation that the community will return the investment when we need it. If we look strictly at this evolutionary and psychological data, true altruism is a biological impossibility. We are simply survival machines trading favors for dopamine. Psychologist Daniel Batson suspected there was a flaw in that cynical math. He proposed the empathy-altruism hypothesis, a specific loophole in our selfish wiring. Look at this schematic of Batson's experiment. He had subjects observe a victim receiving painful electric shocks. The observer was then given two clear options: take the easy exit door and leave the room, or sit in the chair and take the remaining shocks for the victim. When subjects were primed to feel a genuine personal connection with the victim, they completely abandoned the minimax math. They chose the chair and the pain instead of the easy exit. But this intense empathy requires a specific target. We feel sharp grief for a single, relatable figure, like the millions who wept for Princess Diana, but we struggle to process the suffering of millions of faceless victims in large-scale tragedies. Our brains require an individual to connect with. Pure, selfless altruism does exist in human nature, but it requires the precise trigger of one-to-one empathy to override our selfish evolutionary programming. If we possess this profound capacity for empathy, why do crowds routinely ignore victims in public spaces? In 1964, Kitty Genovese was attacked outside her apartment, while dozens of neighbors reportedly heard her screams, yet no one intervened in time. Psychologists Bibb Latané and John Darley tested this paradox. They pumped smoke into a room where people were taking a test. When a person was alone, they quickly reported the emergency. But when placed in a group, individual alarm vanished, and the participants sat passively as the smoke thickened. This happens through a mechanism called pluralistic ignorance. In an ambiguous crisis, we instantly look to the crowd. If no one else is panicking, we use their inaction as proof that no emergency is actually occurring. This graphic illustrates the second mechanism, diffusion of responsibility. If you are the only witness to an accident, you hold 100% of the burden to act. Add 9 other people, and your psychological burden drops to 10%. The responsibility fractures by the exact number of bystanders. Human empathy is highly vulnerable to the environment. In a crowded space, the mathematical safety of numbers actually creates a deadly psychological paralysis. We are biologically capable of both profound selfless sacrifice and chilling crowd-induced apathy. Social psychologists found that this environmental paralysis can be dismantled through pro-social modeling. In a space frozen by pluralistic ignorance, people look to one another for cues. One person taking action signals to the rest of the group that it is safe to care. Recognizing the freeze in an ambiguous emergency is the first step. When you realize that everyone around you is just waiting for a cue, you understand that your action is the catalyst they need. True altruism remains a fragile trait in our evolutionary history, but by recognizing the specific mechanics of a crowd, we can see why everyone is waiting and realize that one person moving is often the only thing required to restart the room's empathy.